Parents tell us every single week. We've been to every specialist, we've run every test, but nobody can tell us why our child is struggling. Our blood work comes back normal. MRIs just show nothing. EEGs are clear, and yet your child is still dealing with chronic ear infections, speech delays, sensory meltdowns. They just can't focus, or just their sleep is struggling and it won't stop. But here's what's happening. Traditional pediatric medicine is looking for pathology and disease. They're asking, is something seriously wrong? But they're completely missing the most important question. How well is the nervous system actually functioning? That's the most important question. Your pediatrician tracks your child's height and weight every visit, but what about the system that controls digestion, immunity, sleep, movement, behavior, emotions, and just development? What about the air traffic controller, the nervous system, which coordinates every single function in your child's body? That's where insight scans come in. And for thousands and thousands of families, these scans finally provided the answers they'd been searching for. So who's this for? This video is for parents who are just exhausted from collecting diagnoses without getting real solutions. Parents who've been told, hey, they'll just grow out of it, or let's just wait and see. Don't just wait and see. When you know deep down something needs to change. This is for families ready to understand what's actually happening underneath all those signs. So you're about to discover why traditional pediatric exams miss the most critical piece of your child's health puzzle. So listen up. You'll learn about 3 types of scans that measure nervous system function, what raging bull and drunken bull patterns mean for your child, and why this objective data changes everything when it comes to getting real answers and real progress. So these scans are so important. It looks deep into the nervous system. So let me tell you a story about Braxton. So at just 1 week old, his parents were told their beautiful baby boy needed to be evaluated for seizures and infantile spasms. Every time they laid him on his back, he went into some kind of like uncomfortable spasm, and he couldn't sleep. They couldn't sleep. They were terrified to even change his diaper. Multiple neurological specialists said the spasms would probably get worse, and the next was his hospital EEG. But while waiting 4 weeks for that appointment, their doctor recommended something vastly different: neurological insight scans. So Braxton's scans showed that his nervous system was just extremely stressed. It was just overly stressed and dysregulated. Birth stress had locked his body into this fight or flight survival mode, unable to calm and coordinate. But here's what made all the difference. The scans didn't just give them another diagnosis. They revealed the root cause and provided a safe plan to help de-stress his body, because his body was just overstressed. After just the first week of gentle, specific chiropractic adjustments, Braxton stopped having spasms. Not a single one. Mom described him as a calm, happy, sleeping beautifully baby. When they finally got that hospital EEG, completely clear of any seizure activity. Braxton is thriving today because his parents got the test that actually mattered. Traditional pediatric care focuses on signs and obvious pathology, but completely overlooks function. Your doctor runs blood work looking for disease markers. They order MRIs to find structural problems, EEGs that check for seizure activity. All of these tests ask the same question. Is there something seriously damaged or diseased? Something that's seriously wrong with my child? But here's the problem. Nearly 1 in 12 children in the US have a speech or language condition, and the vast majority of them have completely normal blood work, MRIs and EEGs, but traditional tests show nothing wrong. These tests often miss what really matters: the nervous system's role in coordinating body functions. The nervous system controls everything. Remember, it's the air traffic controller. So while a pediatrician's height and weight chart indicates growth, insight scans assess whether the system managing growth, your nervous system, immunity, it measures immunity, digestion, sleep, and behavior, and that coordination is functioning properly. So the nervous system is that air traffic controller for your child's entire body. When it's stuck in stress mode from prenatal tension or birth trauma or early life challenges, everything else struggles too. It just compounds. It's a snowball effect. So our Insight technology gives us 3 different scans that work together to show exactly what's happening in your child's nervous system. The first one is the neurothermal scan. It shows how stress affects digestion, immunity, and organ function, helping to explain issues like reflux or constipation, ear infections, frequent illness. The second scan is the neurospinal EMG scan. This measures muscle tension in the spine and nervous system, helping explain just developmental delays, sensory issues, focus problems, and coordination challenges. The third and final scan is the HRV, heart rate variability. This scan shows how well your child adapts to stress, explaining issues with transitions, emotions, and sleep when the nervous system is stuck in overdrive. Together, these 3 scans give us the complete picture that traditional medicine never even looks for. The EMG scan reveals specific stress patterns that explain why your child struggles the way that they do. The first one that we call is the raging bull. The raging bull means the nervous system is just stuck in overdrive. Sympathetics are just kicked in way too hard. It shows up as anxiety, hyperactivity, behavioral issues, poor sleep. Their system just can't shut off. So on the flip side, there's the drunken bull. So the drunken bull shows poor coordination and organization in the nervous system. It leads to focus issues, low muscle tone, sensory struggles, and just learning challenges. So these patterns usually come from a perfect storm of early stress. Those stresses look like pregnancy stress, birth trauma, early illnesses, a bunch of antibiotics, and just ongoing environmental pressure that stack up over time. They just snowball. Research shows that kids with more than 6 rounds of antibiotics before the age of 3 face significantly higher risk for allergies, asthma, gut issues, because those early stressors just compound and lock the nervous system into dysfunction. But the good news is kids aren't stuck like this. So when the nervous system balance is restored, scan patterns change, and so does their health and development, because it gets to the root cause, the nervous system. This changes everything. Insight scans replace guessing with objective data. They show you exactly what's happening and track exactly how your child is healing. That's good news. Therapy can feel like pushing a car with the parking brake on. You're doing everything right, but progress is slow because the foundation just isn't right. Your nervous system is the foundation. So an Insight scan shows stuck stress patterns in the nervous system, like dysautonomia. It explains why therapies stall and shows exactly what needs fixing. By restoring nervous system balance, other therapies finally start working like they were designed. And parents see changes in sleep, digestion, behavior, focus, immunity, often with weeks improving through re-scans. We do these progress scans. If you're tired of hearing wait and see or collecting labels without getting real answers, Insight scans might be exactly what your family needs. These scans reveal what traditional medicine overlooks, giving you a clear path forward instead of just guesswork, guys. Your child deserves more than just trait management. They deserve to have their nervous system functioning at its full potential so they can finally thrive, which means that you can thrive as a parent. So click the link in our bio, send us a DM, or schedule directly with myself, Dr. Mike Gensler, at Petersburg Family Chiropractic in Petersburg. Let's get your child the answers and help that they deserve.